Welcome to this week's edition of Public Health Updates, covering the latest breakthroughs. Brought to you by LucidQuest. Adults aged 80 and above with exceptional memory, known as SuperAgers, show minimal cortical thinning compared to people 20 to 30 years younger. Autopsies reveal few amyloid plaques and tau tangles, both hallmarks of Alzheimer's disease. Researchers believe a combination of biological and lifestyle factors may protect against dementia, though the exact causes remain unclear. Emergency visits for tick bites have reached their highest levels since 2017, with Lyme disease cases continuing to climb. Climate change is expanding tick habitats into new regions of the United States and Canada. Experts recommend wearing protective clothing, using permethrin-treated gear, staying on trails, and performing thorough tick checks. A single 45-minute resistance or high-intensity interval training session increased cancer-fighting myokines by up to 30% in breast cancer survivors. While the effects were short-lived, they mirror anti-cancer responses seen in laboratory models, supporting exercise as a valuable complementary cancer care strategy. Brain tissue samples from 2023 show higher levels of microplastics compared to samples from 2016. The health impacts are still uncertain, but some research links vascular buildup to greater cardiac risk. As global plastic production rises, experts urge precautionary action. A new microneedle patch called ExoPatch can collect exosomes from skin to detect melanoma without the need for a biopsy. In mouse studies, melanoma tissue produced test lines 3.5 times darker than healthy skin. The device could enable at-home screening and adaptation for other cancers. Up to 5,000 men each year in the United Kingdom may receive unnecessary prostate cancer treatment due to outdated guidelines. For slow-growing cancers, active surveillance could prevent harmful side effects. Researchers are calling for updated NICE recommendations to match current diagnostic advances. A new cancer vaccine, ELA-002-2P, targets Kras mutations in pancreatic and colorectal cancers. In a trial of 25 patients, 17 developed strong immune responses and experienced longer relapse-free survival. Larger controlled trials are needed before the vaccine can be introduced to clinical practice. Physical activity appears to decline about 12 years before a diagnosis of heart disease, with the drop accelerating in the final 2 years. Black men show steady declines from youth, and Black women report the lowest lifetime activity levels. These findings highlight the need for early and targeted prevention efforts. In prairie voles, oxytocin is not essential for forming friendships, but significantly accelerates and strengthens the bonding process. Voles lacking oxytocin receptors took a week to bond, compared to a single day for typical voles. The research could improve understanding of social disorders in humans. Finally, 6 months of conch shell blowing, known as shonk blowing, reduced daytime sleepiness by 34% and decreased sleep apnea episodes by 4 to 5 per hour. The likely mechanism is strengthening of upper airway muscles, offering a low-cost alternative or supplement to CPAP therapy. Stay ahead in public health research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com.